My name is Greg Cryan. I'm presenting today from Durban, South Africa. I am a past district governor of District 9370, which is one of 3 districts in South Africa. I'm also privileged to be a board member of the Rotary Action Group for Family Health and AIDS Prevention, Incorporated. Half of the world's population cannot access affordable health care. RIFA's Rotary Family Health Day program bridges that gap. COVID-19 has resulted in other diseases having been neglected, and many programs, such as those targeting HIV and AIDS and TB, have been set back by 6 or more years. The Rotary Family Health Day program is a significant contributor to preventative health care. Ministers of health in the countries in which we operate partner with RIFA with signed letters of intent in support of the Rotary Family Health Day program. Other partner organizations such as media houses, private sectors, funders, etc., also do the same. Pick up the next slide, please. Who are we and why do we do what we do? The Rotary Action Group for Family Health and AIDS Prevention is a global action group and a mobilizing partner of Rotary International's dedicated to disease prevention and treatment. RIFA is a proven program of scale that delivers preventative community health care in Africa. Our programs provide free multiple health screens, life-saving immunizations, education on disease prevention and treatment, and referrals for follow-on care that would otherwise not be accessible. Headquartered in Atlanta in Georgia, USA, RIFA manages a Pan-African network of managing directors and teams in each country that facilitate the program implementation and local relationships. Next slide, please. So what do we do? Next slide, please. The uniqueness of our program is that it is delivered through a massive public and private partnership. The Rotary brand enables us to work with and bring together all sectors of society in countries where the health days take place. These include governments, private sector, media, and civil society, not to mention the thousands of Rotary volunteers who will make all this possible on the ground. Each has a defined role and responsibility, and they do not compete. All services are donated. RIFA is the convener of the program. Someone needs to hold the partnership together, and RIFA is illustrated by the circular icon in the center of this particular slide. Next slide, please. So what do we do? RIFA's program in the Rotary Family Health Days is a unique public-private partnership program, is currently in its 11th year of operation. The 3-day integrated annual program provides holistic, comprehensive, preventative health programs, both for communicable and non-communicable diseases. The program leverages and inspires a massive force of humanitarian-driven volunteers through Rotary clubs in multiple countries in Africa and India. Since inception of the Rotary Family Health Days in 2011, over 2.6 million patients have been offered over 11 million free health services. Next, please. These are some of the services that are rendered across the Family Health Days. From left to right, we have all events we screen, test for, refer to HIV, AIDS, TB, hepatitis B and C, malaria, diabetes, blood pressure, cholesterol, cancers, distribution of male and female condoms, hygiene packs, eye readers, dental cleaning supplies. Areas of need are based on availability in each country. Optometrist, audiology, and dental examinations. And on the mental health counseling, we have general health awareness programs on family planning and antenatal care. And then lastly, immunization for polio, measles, rotavirus, and HPV, deworming tablets, vitamin A, supplements for children, and many more. Next slide, please. So looking at our areas of operation, the 3-day family campaign has operated in over 1,000 health sites through the efforts of over 19,000 Rotarians, Rotaractors, and community volunteers. Rotary Family Health Day sites in Africa have been held across Nigeria, South Africa, Uganda, Ghana, Benin, Togo, Cote d'Ivoire, Lesotho, Eswatini, and Zambia. We are currently represented in Asia and India, and we are in the process of encouraging West African countries to partner with us. Next slide, please. So how do we do this? Next slide. By leveraging the Rotary brand, the Action Group has developed a funding model that has facilitated that all services are donated. So for a comparatively small cash donation of $1 million US, using partner funds and global grant matching, it has enabled RIFA to build a program that is conservatively valued at $45 million US per annum. So our leveraging via Rotary Foundation is incredible and extremely important to us, as is our communication and relationships with big pharmaceutical companies, the likes of Gilead, et cetera, et cetera. Next slide, please. A two-pronged monitoring and evaluation system has been developed by RIFA in collaboration with the Center for Disease Control and Prevention and the South African National Department of Health. Data collection is a critical outcome of the campaign, and inputs are tracked. The inputs that are tracked include total number of patients and age profile reached per site, total number of patients reached per service, per province, total number of patients that tested positive to an illness, and the total number that we referred to follow-on care. Next slide, please. Some of the findings from the impact study that is done, we normally do this 90 days after a 3-day activation. The findings from the 90-day impact study confirms that the Rotary Family Health Days are making a difference at the testing level, as well as ensuring the link to care is formalized and monitored. And you can see on the slide that we've seen over 2.5 million people. 98% of those said they were treated with respect. 94% of respondents said they would come again. 84% said they received follow-ups on referrals, and many respondents have asked that this happens once a month, which is pretty much impossible. Most of these campaigns are done out in the rural areas. The intention is to take the campaign out into the rural areas because it's so difficult for people to travel into town. Next slide, please. So this is how we can work together. Next slide, Indy, thank you. Collectively, through RIFA, individual Rotarians and Rotary clubs have the ability to collaborate and become part of a larger and more comprehensive response to disease prevention than they do when working individually at club level. They become a stronger voice and a part of an organization that is generating large multi-sector, multi-country partnership programs in response to disease prevention. In closing, I'd like to quote a quote from our former President Nelson Mandela, who once said, "A new world will be won not by those who stand at a distance with their arms folded, but by those who are in the arena." Next slide, please. That, in fact, was the last slide, and I just would like to thank the forum for the absolute privilege of being able to present the Rotary Family Health Day program